Are you a breastfeeding mom wondering if it's safe to take Nyquil? In this video, I'm going to discuss the safety of using Nyquil while breastfeeding and provide tips on how to minimize any potential risks. 1. Is it safe to take Nyquil while breastfeeding? The short answer is yes. Nyquil is considered safe for breastfeeding moms. However, there are some important considerations to keep in mind when using this medication. Nyquil contains several ingredients that can pass into breast milk and be consumed by a nursing infant. The most common active ingredient in Nyquil is acetaminophen, but it also contains dextromethorphan and doxylamine succinate. In general, these ingredients have not been found to have an adverse effect on nursing infants when taken in recommended doses. However, because every mother's body chemistry and her baby's individual needs are unique, it is always best to talk with your doctor before taking any medication while breastfeeding. 2. Are there any potential risks associated with taking Nyquil while breastfeeding? Although Nyquil is generally considered safe for breastfeeding moms, there may be potential risks associated with taking it while breastfeeding. The active ingredients in Nyquil, dextromethorphan, doxylamine, and pseudoephedrine, are all known to cross into breast milk. Although the effects of these medications on a baby's health remain largely unknown, there have been reports that some babies may experience increased irritability or restlessness when their mothers take Nyquil. Additionally, infants exposed to high doses of pseudoephedrine have shown signs of drowsiness or breathing problems. Therefore, it is important for nursing moms to weigh the potential risks before taking Nyquil while breastfeeding. 3. Are there any ingredients in Nyquil that can be harmful to the baby? Nyquil does contain some ingredients that may be of concern to nursing mothers. Dextromethorphan, an active ingredient in Nyquil, can pass through breast milk and potentially cause drowsiness or irritability in infants. Acetaminophen, another active ingredient in Nyquil, is generally considered safe for breastfeeding mothers. However, very large doses over long periods of time could be harmful to the baby. The other inactive ingredients in Nyquil, such as alcohol, may also be of concern for breastfeeding moms. It's important to talk to your doctor about any potential risks before taking Nyquil while breastfeeding. In cases where a mother needs relief from cold and flu symptoms, it is often recommended to take a single dose of Nyquil and then pump and discard the milk for at least 8 hours afterward. This will help to ensure that any active ingredients do not pass through breast milk and into the baby. It's also important to note that breastfeeding mothers should always take medications as directed by their doctor and read any warnings on the product packaging before taking them. Ultimately, it is up to each mother to decide whether or not they are comfortable taking Nyquil while breastfeeding. It is always recommended to consult with a healthcare professional before taking any medication while nursing. 4. What are some alternative options for treating cold and flu symptoms while breastfeeding? Many nursing mothers have found relief from their cold and flu symptoms by using natural remedies such as herbal teas, homeopathic medicines, aromatherapy, and dietary changes. Other options include taking over-the-counter medications such as ibuprofen or acetaminophen Tylenol, both of which are considered safe while breastfeeding. You should always consult with your doctor before taking any medications while nursing. Additionally, it is important to stay hydrated and get plenty of rest during a cold or flu bout. 5. How should I take Nyquil to minimize any potential risks? If you decide to take Nyquil while breastfeeding, it is important to take the medication in a way that minimizes any potential risks or side effects. It is best to avoid taking more than one dose of Nyquil within 24 hours and only use it as needed. You should also try using the lowest possible effective dose for shortest amount of time necessary in order to achieve symptom relief. It is generally suggested that pregnant and lactating women not take more than 2,000 mg/mg of acetaminophen per day. So be sure to keep track of how much you are taking when using Nyquil. 6. Are there any drugs that are considered safe to take while breastfeeding? Yes, there are a number of medications that are considered safe to take while breastfeeding. The best way to determine if a medication is safe for you and your baby is to speak with your doctor or pharmacist about any possible risks or side effects before taking it. Commonly prescribed medications that have been found to be safe during breastfeeding include acetaminophen, ibuprofen, antihistamines such as diphenhydramine, some antidepressants, and thyroid hormone replacement. Nyquil has not been studied in lactating women. However, its active ingredients acetaminophen and doxylamine are generally considered safe while breastfeeding. As always, it's important to talk with your doctor before taking any medication. 7. Are there any other steps I can take to ensure the safety of my baby while taking Nyquil? Nes? Aside from talking to your doctor and following their recommendations, there are a few other steps you can take to ensure the safety of your baby while taking Nyquil. Firstly, try to limit how much medicine you take. As with any medication, it's important to only take the recommended dose and not exceed it. It may also be helpful to skip doses if possible or alternate doses with cold medications that don't contain alcohol. Additionally, if you start feeling better after taking Nyquil for a few days, talk to your doctor about stopping its use so that your baby isn't exposed for longer than necessary. We hope this video has given you some helpful information about the safety of Nyquil for breastfeeding moms. Remember, if you have any questions or concerns, it's always best to consult with your doctor before taking any medication while nursing. If you found this video valuable, please like and subscribe to our channel so that we can continue providing useful content on health topics such as these. We would also love to hear from you in the comments section below. Thanks for watching.